In 1983, a French virologist made a discovery that would change the course of one of the most devastating epidemics in human history. Françoise Barré-Sinoussi identified a new retrovirus that would later be known as HIV, the cause of AIDS. This breakthrough marked the beginning of a lifelong commitment to science and global health that continues to save countless lives. Born in Paris in 1947, Barré-Sinoussi showed an early passion for science. As a young student, she was drawn to natural sciences, spending hours observing and documenting the behaviour of animals in nearby parks. This curiosity led her to pursue studies in natural sciences and eventually virology at the University of Paris. Her scientific journey took a decisive turn when she joined the Pasteur Institute in Paris, working under renowned virologist Luc Montagnier. It was here, in the early 1980s, amid growing reports of a mysterious immune deficiency syndrome affecting communities around the world, that Barré-Sinoussi made her historic contribution. The discovery came through meticulous laboratory work, examining tissue from a patient with lymphadenopathy, a condition often preceding AIDS. Barré-Sinoussi detected the presence of reverse transcriptase activity, a telltale sign of a retrovirus. This finding, published in Science in May 1983, identified what would later be named human immunodeficiency virus, or HIV. What distinguished Barré-Sinoussi from many scientists was her refusal to remain in the laboratory after this discovery. She understood that identifying the virus was only the first step in addressing a growing global health crisis. She immersed herself in the clinical aspects of the disease, working directly with patients and doctors to better understand how the virus behaved in the human body. Her approach to HIV research was revolutionary for its time. She advocated for multidisciplinary collaboration, bringing together virologists, immunologists, clinicians, and epidemiologists. She recognized that defeating HIV would require more than just understanding the virus. It would need comprehensive strategies for prevention, treatment, and care. As the AIDS epidemic spread globally, so did Barré-Sinoussi's influence. She established collaborations with researchers in developing countries, particularly in Africa, where the epidemic was devastating communities. She trained local scientists, helped establish research centres, and worked with community organisations to develop culturally appropriate prevention strategies. Her tireless efforts did not go unrecognised. In 2008, 25 years after her initial discovery, Barré-Sinoussi was awarded the Nobel Prize in Physiology or Medicine, sharing the honour with her colleague Luc Montagnier. The Nobel Committee recognised their discovery as essential to understanding the biology of the disease and developing diagnostic tests and treatments. Beyond the Nobel Prize, Barré-Sinoussi has received numerous honours for her scientific achievements and humanitarian work. She has served as the president of the International AIDS Society and as a consultant to the World Health Organization and UNAIDS, helping shape global policies on HIV prevention and treatment. Throughout her career, Barré-Sinoussi has been a vocal advocate for science-based policies and against stigma and discrimination. She has consistently emphasized that HIV is not just a scientific challenge, but a social and political one as well. Her advocacy has helped shift the global conversation around HIV, from fear to understanding, from hopelessness to action. Even after her retirement from the Pasteur Institute in 2015, Barré-Sinoussi continues to be an influential voice in global health. Her legacy extends beyond her scientific discoveries to the research infrastructure she helped build and the generations of scientists she has inspired. Françoise Barré-Sinoussi's story reminds us of the profound impact one dedicated scientist can have on global health. From identifying a virus in a Paris laboratory to shaping international health policy, her work demonstrates how scientific discovery, when coupled with compassion and advocacy, can change the world. Her contributions have not only advanced our understanding of HIV, but have saved millions of lives and continue to guide our response to one of the most significant public health challenges of our time.